A tragic health crisis has shocked the world, with more than 130 people, most of them children, testing positive for HIV in a city of Pakistan. The tragic incident has been reported in a government-run hospital in Karachi. Here we reveal what happened at Kulsum Bai Valika Hospital that led to the outbreak. The story surfaced publicly in November 2025, when residents and local clinicians raised alarm about an unusual cluster of pediatric HIV infections. Provincial authorities say the first linked cases appeared in October 2025, following which more than 10,500 people around the hospital were screened by July 2026. At least 120 samples tested positive at Kulsum Bai Valika Hospital, and another 10 cases were found at a related SESSI facility in Landi, bringing confirmed cases to 130 and counting. Investigations now point to failures inside Sindh's state-run healthcare system. What investigators found: two internal probes and a Sindh Healthcare Commission inspection revealed glaring safety lapses. Infection prevention protocols weren't followed, protective equipment was misused or unavailable, and crucially, single-use syringes were handled improperly. Inspectors even reported staff couldn't explain how used needles were disposed of. Simply, guidelines drawn to prevent transmission of blood-borne infections appear to have not been followed seriously inside a public healthcare facility. How transmission likely occurred: medical transmission of HIV, while rare in countries with robust infection control, becomes a real risk when single-use items are reused, sharps are handled unsafely, or sterilization is inadequate. In this outbreak, the pattern, many children, linked to the same hospital, strongly suggests iatrogenic spread, infections caused by medical procedures rather than sexual or intravenous drug routes. That is a public health failure, not just an epidemiological problem. What authorities are doing and what should happen next? Authorities have started mass screening, launched investigations, and shuttered or scrutinized implicated facilities. But effective next steps must include rapid confidential testing and linkage to antiretroviral treatment for all positive cases. Transparent, independent epidemiological inquiry to trace transmission chains. Immediate infection, control training and supply of single-use equipment. Safe disposal systems for sharps. Legal accountability for negligence, and a public communications campaign to rebuild trust and fight stigma.